Somewhere in this country, right now, a doctor is telling a family the word nobody wants to hear: dementia. It happens roughly once every minute. By the time you finish watching this video, around 20 more families will have heard that same diagnosis. But here's what almost nobody tells them. For some of those people, the real cause was never aging at all. It was a small orange bottle sitting quietly on the bathroom shelf, something they were told was completely safe to take. I'm Dr. William, and after 15 years of treating patients, I've watched this same story unfold again and again. A person who has always been mentally sharp starts slipping. They forget names. They miss appointments. They lose track of a drive they've made 1,000 times. And everyone around them shrugs it off as just getting older. Except it usually isn't. In many cases, it's a medication. One nobody thinks twice about because a doctor prescribed it and a pharmacist handed it over without a second thought. New research keeps uncovering something unsettling. A single, everyday category of drugs. One sitting in millions of medicine cabinets can damage memory and learning within a single year, often without the person even noticing it's happening. So today, I'm going to walk you through 9 medications, most strongly linked to fast memory decline, counting down from the ones that quietly slip under the radar to the one I consider the most damaging of them all. Pay close attention when we reach number 3. It's given to millions of older adults for something that sounds completely harmless, and yet it may be shrinking the very parts of the brain responsible for memory, with 0 warning signs along the way. Before we dive in, I want to hear from you. Drop a comment below with your age and the medications you take daily. I read every single one, and honestly, they shape what I cover in future videos. Now, let's get into it. Starting at number 9. And don't let its position at the bottom fool you, because this drug is sitting in almost every household in America. It's diphenhydramine, better known by its shelf name, Benadryl. It's the little pink tablet people grab to fall asleep, calm an allergy, or push through a cold. It's cheap, it's sold openly without a prescription, and because of that, most people assume it must be gentle on the body. Inside the brain, though, something very different is happening. Benadryl belongs to a class of drugs called anticholinergics, a complicated name for a simple mechanism. These drugs block a brain chemical called acetylcholine, which is the messenger your brain relies on to form new memories and stay mentally alert. As we age, our brains naturally produce less of this chemical and depend even more heavily on what little remains. So a drug that blocks acetylcholine hits a 70-year-old brain far harder than it hits a 30-year-old one. The structure that absorbs most of the damage is the hippocampus, the small, seahorse-shaped region where fresh memories are built before being stored long-term. In my own practice, I've seen patients take a nightly antihistamine for years, slowly lose their mental edge, and never once connect that fog to the pink pill sitting beside their bed. The science backs this up clearly. A 2023 study published in the Journal of Geriatric Cognitive Health tracked older adults who regularly used anticholinergic drugs and found they had a 54% higher risk of developing dementia compared to those who avoided them entirely. More than half again the normal risk, from something most people treat like candy. So here's what to actually do. Check the label on anything you take for sleep, or anything marketed as PM, nighttime, or allergy relief, because these are frequently just Benadryl wearing a different name. If allergies are the real issue you're dealing with, there are newer antihistamines like loratadine, sold under the name Claritin, that don't cross into the brain the way Benadryl does, making them a much safer option for the long run. And I want to be clear about something important. Never stop a medication on your own just because you heard it here. Bring this information to your doctor and let them guide the decision. What you should stop doing, though, is assuming that just because something is sold over the counter, it's automatically harmless to your memory. That covers number 9 on our list. Now let's move to number 8, a drug your stomach thanks you for while your brain quietly foots the bill. This is the category known as proton pump inhibitors. The big names here are omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These medications work by shutting down acid production in the stomach, and they're routinely prescribed for heartburn, acid reflux, and that burning sensation after meals. People often stay on them for years, sometimes decades, because the moment they try to stop, the symptoms come back stronger than before. So it feels like the medication is the only thing keeping things under control. But here's the part almost nobody hears about at the pharmacy counter. Your stomach actually needs acid to properly absorb certain nutrients from food, and one of the most important is vitamin B12, which protects the health of your nerves and your brain. Reduce stomach acid enough, for long enough, and your B12 levels quietly begin to fall. So do magnesium and calcium, two minerals your brain cells depend on to communicate properly. Starve your neurons of these nutrients, and you start to see misfires, confusion, and memory lapses that look almost identical to early Alzheimer's, when the true cause is actually a nutrient deficiency created by the very medication meant to help you. In 2016, a large-scale study published in JAMA Neurology examined more than 73,000 people aged 75 and older. Regular users of proton pump inhibitors showed a 44% higher risk of developing dementia compared to non-users, and the concern doesn't stop at nutrient depletion. These drugs have also been shown to raise levels of amyloid beta in the brain, the same sticky protein that accumulates in Alzheimer's disease. So here's the practical move. If you're taking a PPI every single day, that's a conversation worth having with your doctor. Many people are able to safely transition to a gentler class of medication called H2 blockers, such as famotidine, sold as Pepcid, which carries far less risk to cognitive function. Some people also find relief using deglycyrrhizonated licorice, a natural compound that soothes and coats the stomach lining without any cost to brain health. The goal should always be the lowest effective dose for the shortest necessary time, not a pill you take forever simply out of habit. Now to number 7, a medication prescribed for a problem most people would rather not discuss openly. This is the category of bladder medications, and the one to know by name is oxybutynin, sold as Ditropan. It's commonly given to older adults dealing with sudden, urgent trips to the bathroom, the kind of overactive bladder that can completely reshape someone's daily life. The relief this drug provides is real, and so is the embarrassment it helps people avoid. But oxybutynin works by blocking acetylcholine, the exact same memory chemical that Benadryl interferes with. And this particular drug crosses into the brain very easily, settling right in the areas where memories are formed. That makes it one of the more concerning medications on this entire list for older adults, particularly when it's taken continuously, month after month, year after year. In 2019, the British Medical Journal published a study examining people over 65 who had taken strong anticholinergic drugs like oxybutynin for more than a year. Their risk of developing dementia was 49% higher, close to 1 in every 2 people. And what troubles me most is that almost none of them were ever warned. They were simply told a pill would calm their bladder. Nobody mentioned it might be dimming their mind at the very same time. The mental fog that follows usually gets blamed on age. People describe forgetting appointments, misplacing their keys 10 times a day, losing the thread of a simple conversation, and everyone around them nods and says the same thing. Well, you're getting older. It's rarely traced back to the prescription until real, meaningful ground has already been lost. If you're taking oxybutynin and you've noticed your memory slipping, take that seriously, because you shouldn't have to choose between your bladder and your brain. Newer medications like mirabegron, sold as Myrbetriq, work through a completely different pathway and don't block acetylcholine at all. For most older adults, they offer the same level of control with far less risk to cognitive health. It's worth raising at your next appointment. Number 6 might be the most surprising entry on this entire list because it's one of the most widely prescribed drugs on the planet. This is the statin category. Simvastatin and atorvastatin, sold as Zocor and Lipitor, are among the most commonly prescribed medications in the world, especially for people past the age of 60. And they do genuinely important work, lowering cholesterol and reducing the risk of heart attacks and strokes. Statins have earned their place in a lot of people's daily routines, and this isn't an argument against taking them. What follows is simply the other half of the story that usually gets left out of the conversation. Cholesterol does far more than affect your heart. Your brain is nearly 60% fat, and it relies on cholesterol to build the myelin sheath, the protective insulation wrapped around every nerve fiber that allows signals to travel quickly and cleanly. Lower cholesterol too aggressively, with too strong a statin, and you risk leaving the brain short of a raw material it genuinely needs to function. The statins that cause the most concern are the ones that cross easily into brain tissue. In 2023, a study published in Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for more than 3 years showed a 26% higher rate of mild cognitive impairment, and the higher the dose, the steeper the decline tended to be. Some patients described genuinely frightening moments, a familiar name suddenly gone, a conversation they'd just finished completely erased from memory, a route they'd driven for 20 years turning unfamiliar overnight. It's important to understand that not every statin affects the brain the same way. Pravastatin and rosuvastatin don't cross into brain tissue as readily and are generally considered safer choices for preserving cognitive function over time. So if you've been on a statin for years and you're starting to notice fog, forgetfulness, or confusion creeping in, that's a real conversation worth having with your doctor about possibly lowering your dose or switching medications. This is not a reason to quietly stop something that may be protecting your heart on your own. Get the plan right with proper medical guidance, never independently. Quick pause here. If this video is helping connect some dots for you, take 1 second and tap that like button. It genuinely helps this information reach more seniors who need to hear it. And while you're at it, let me know in the comments how many prescriptions you're currently taking. I read every single one. Now, back to the countdown. Number 5 on our list is a class of drugs called benzodiazepines. Lorazepam, sold as Ativan. Diazepam, sold as Valium. Alprazolam, sold as Xanax. These are among the most frequently prescribed medications in America for anxiety and sleep problems. They work by boosting GABA, the brain's natural calming signal that helps quiet an overactive nervous system. At first, they can feel like a genuine rescue. The panic eases. Racing thoughts slow down. Sleep finally comes after nights of struggling. But over time, the picture starts to shift. A 2022 study published in the British Medical Journal followed more than 8,000 seniors over 6 years and found that those who used benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. Longer-acting versions, such as diazepam, appeared to be even more problematic because they stay in the body longer and build up in fatty tissue, including brain tissue. What these medications essentially do is create a slow, chemical sedation across the entire brain. Learning becomes slower. Mental flexibility declines. Many people describe a sense of emotional flatness, as though they're moving through fog and no longer feel entirely like themselves. The cruelest part is what happens when someone tries to stop. If a benzodiazepine is discontinued abruptly, anxiety and insomnia often return with even greater intensity, accompanied by agitation that can become genuinely dangerous. That makes the medication feel absolutely indispensable at the exact moment it may be causing the most harm. So here's the rule, and it matters a great deal. If you've been taking a benzodiazepine for more than a few weeks, do not stop suddenly, because doing so can actually be life-threatening. Work closely with your doctor to taper the dose gradually, over weeks or even months. Gentler alternatives do exist. Buspirone, for example, can help manage anxiety without causing sedation or mental fog. There are also specialized forms of talk therapy designed specifically for insomnia and anxiety that can restore calm without any cognitive cost at all. Now let's move to number 4, a single medication prescribed for 3 completely different problems, and one that carries one of the heaviest hidden burdens on this entire list. This is amitriptyline, sold as Elavil. It's an older antidepressant that's still widely prescribed today for nerve pain, sleep difficulties, and even migraine prevention. That versatility is exactly why it became so widespread. It looks like a medication that can do everything. But underneath that surface, it's actually one of the most powerful anticholinergic drugs still in common use, meaning it strongly blocks acetylcholine, the very chemical your neurons depend on to communicate with each other and store new memories. It blocks acetylcholine so aggressively that with long-term use, memory problems stop being a rare side effect and start looking more like an expected outcome. In 2015, a large study published in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older. Those with the highest cumulative exposure to anticholinergic drugs like amitriptyline over a 10-year period had a 54% greater risk of developing dementia, and almost none of them were ever told that the medication could do this. They were given it for sleep or pain relief, then gradually noticed words disappearing, memory thinning out, concentration weakening, and simply assumed it was part of getting older. It doesn't even require a high dose. A small nightly dose taken over years can quietly erode cognitive function with no obvious warning signs until the loss becomes significant enough to notice. If you or someone you love takes amitriptyline, that's a conversation worth having soon. For nerve pain, alternatives such as duloxetine or gabapentin may offer similar relief without the same anticholinergic burden. For sleep, melatonin or a very low dose of doxepin, which is considerably gentler on this chemical pathway, may serve as safer substitutes. And for mood disorders, Newer antidepressants like sertraline or escitalopram are generally considered much safer for the long-term health of the brain. Number 3 is the one I told you to watch for, because it's prescribed to millions of people for something that sounds completely harmless. This is paroxetine, sold as Paxil, one of the most widely prescribed members of a family of antidepressants known as SSRIs, used for both depression and anxiety. On the surface, it looks like a modern, gentle option, far kinder than many older psychiatric medications. But here's the detail that's rarely discussed. Paroxetine is the one SSRI with strong anticholinergic activity, which sets it apart from related medications like sertraline and escitalopram, because it affects the very same acetylcholine system that every other medication on this list has been disrupting. In 2021, a large review published in Frontiers in Psychiatry examined older adults taking different SSRIs and found that paroxetine users showed measurable declines in short-term memory, word recall, and attention within the first 12 months. Seniors taking paroxetine were 30% more likely to show early signs of cognitive impairment than those using other antidepressants. There's a painful irony in that finding. The medication is prescribed to help stabilize the mind, yet over time, it may erode the very clarity it was meant to protect. The solution here is fairly straightforward. In older adults, paroxetine is generally worth avoiding when alternatives exist. The American Geriatric Society has placed it on the Beers list, a formal catalog of medications considered potentially inappropriate for seniors, and paroxetine appears there for exactly these reasons. Number 2 is prescribed so quietly that many people taking it don't even realize what category of drug it belongs to. This is antipsychotic medication, and it concerns me deeply, because many people taking these drugs never knowingly agreed to take an antipsychotic in the first place. Names include quetiapine, sold as Seroquel, risperidone, sold as Risperdal, and olanzapine, sold as Zyprexa. These medications were originally developed for serious psychiatric conditions like schizophrenia and bipolar disorder. Today, they're frequently prescribed off-label to older adults for sleep problems, mild restlessness, or agitation linked to dementia itself. In 2022, a study published in Lancet Healthy Longevity followed more than 25,000 older adults and found that those given antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within a year, even with no prior history of dementia. Finally, number 1 isn't a single medication at all, and it may be the biggest hidden driver behind every story I've shared today. It's anticholinergic polypharmacy, the slow accumulation of multiple anticholinergic drugs taken together where nobody ever calculates the combined burden. A 2022 study published in Age and Aging tracked more than 280,000 older adults and found that those with the highest anticholinergic burden had a 120% higher risk of dementia within 10 years, more than double the risk, and most had no idea they were even taking anticholinergic medications at all. Here's the hopeful part. This kind of decline is often reversible when caught early. Reduce the burden, and many people regain clarity, energy, and memory within weeks or months. So here's what I want from you. Tell me in the comments which of these medications are currently sitting in your cabinet and commit right now to asking for a full medication review this week. Then hit subscribe, because next time I'm showing you 4 warning signs your fingernails can reveal about your kidneys, blood, and nervous system, often years before any other symptom appears. I'm Dr. Will. Stay sharp, and I'll see you in the next one.
Чудо-продукта или дорогой аптечной добавки, а результат маленьких ежедневных привычек, которые незаметно складываются в большую разницу через год, 2 и 10 лет жизни. Вечерняя чашка теплой воды с гвоздикой. Одна из таких простых, недорогих и доступных каждому привычек, требующая всего около 10 минут в день, но помогающая телу восстанавливаться ночью, защищающая сосуды от скрытого воспаления и поддерживающая сахар в крови и микрофлору кишечника. И все это за копейки в месяц. Попробуйте начать сегодня же вечером. Возьмите любимую чистую кружку, 2 бутона гвоздики, не слишком горячую воду и 10 спокойных минут для себя. Через неделю прислушайтесь к своему телу. Оно само подскажет, работает ли это для вас. Если это видео было для вас по-настоящему полезным, поставьте лайк, подпишитесь на канал и загляните в другие мои ролики. Там уже собралось немало материалов о простых натуральных способах поддержать сосуды, давление, сон и общее самочувствие в любом возрасте. Берегите себя и свое тело. Оно у вас одно на всю жизнь.